Q. Is there a vaccine for hepatitis C? A. No. Card 134Q. What is the major immune system target of HIV? A. T lymphocytes, with declining CD4 levels associated with increasing AIDS-related disease. Card 135Q. How is HIV initially screened according to the chapter? A. With an antibody screening test such as an enzyme immunoassay, followed by confirmatory testing if reactive. Card 136Q. What does a reactive HIV screening test mean? A. It requires additional confirmatory testing. A reactive screening result alone does not establish the final diagnosis. Card 137Q. What is the purpose of pretest HIV counseling? A. Assess risk, explain positive and negative results, obtain informed consent, and develop a realistic risk reduction plan. Card 138Q. What is the goal of ART during pregnancy? A. Reduce the maternal viral load to an undetectable level and maintain suppression. Card 139Q. What is an important adverse effect of ART identified in the chapter? A. Bone marrow suppression, requiring monitoring of hematocrit, WBC, and platelet counts. Card 140Q. What breastfeeding teaching is given for women with HIV in the United States? A. The chapter recommends avoiding breastfeeding to reduce transmission risk. Section 16. Group B, Streptococcus, and torch. Card 141Q. Can Group B Streptococcus be normal vaginal flora? A. Yes, particularly in non-pregnant women. Card 142Q. When should pregnant women be screened for GBS? A. At 35 to 37 weeks using a rectovaginal culture. Card 143Q. What is given to women who test positive for GBS during labor? A. IV antibiotic prophylaxis. Card 144Q. What does torch represent? A. Toxoplasmosis, other infections, rubella, cytomegalovirus, and herpes simplex. Card 145Q. Why are torch infections important? A. These organisms can cross the placenta and cause serious fetal or neonatal effects. Section 17. Benign breast conditions. Card 146Q. What is micromastia? A. Congenital underdevelopment of breast tissue. Card 147Q. What is macromastia? A. Excessively large, heavy, pendulous breasts. Card 148Q. What are fibrocystic breast changes? A. Benign breast changes characterized by bilateral lumpiness, tenderness, and sometimes cyst formation. Card 149Q. When are fibrocystic breast symptoms usually worse? A. About 1 week before menstruation, with improvement after menstruation ends. Card 150Q. What is the first imaging study that may distinguish a cyst from a solid breast mass? A. Ultrasound. Card 151Q. What is a fibroadenoma? A. A benign breast tumor that is usually a discrete, mobile, well-defined lump and is common in adolescence. Card 152Q. How does a fibroadenoma behave during the menstrual cycle? A. Unlike cysts, it does not usually enlarge in response to the menstrual cycle. Card 153Q. What is mammary duct ectasia? A. Dilated breast ducts, often associated with acquired nipple inversion and greenish nipple discharge. Card 154Q. What is a characteristic finding of intraductal papilloma? A. Spontaneous unilateral serous, serosanguineous, or bloody nipple discharge. Card 155Q. What is galactorrhea? A. Bilateral spontaneous milky nipple discharge, which may occur normally during pregnancy or with elevated prolactin. Section 18. Breast cancer. Card 156Q. What is the most important breast cancer risk factor identified in the chapter? A. Age. Breast cancer risk increases as women age. Card 157Q. What genetic mutations are strongly associated with hereditary breast cancer? A. BRCA1 and BRCA2 mutations. Card 158Q. What is invasive ductal carcinoma? A. The most common breast cancer type, originating in the lactiferous ducts and invading surrounding breast tissue. Card 159Q. What is Paget disease of the breast? A. A cancer involving the nipple that may cause bleeding, oozing, and crusting. Card 160Q. What is inflammatory breast cancer? A. An aggressive breast cancer associated with reddish skin or a rash and cancer cells in dermal lymphatic channels. Card 161Q. What is peau d'orange? A. Orange peel-like skin changes caused by edema and shortening of Cooper ligaments from invasive breast cancer. Card 162Q. What does TNM staging evaluate? A. Tumor size, lymph node involvement, and metastasis. Card 163Q. What is the gold standard screening test for breast cancer? A. Mammography. Card 164Q. What is the difference between screening and diagnostic mammography? A. Screening mammography evaluates women without breast symptoms. Diagnostic mammography evaluates an abnormal finding or new breast symptom. Card 165Q. What are microcalcifications? A. Fine calcium deposits that can be concerning when clustered and irregular because they may indicate DCIS or early breast cancer. Card 166Q. What is the role of ultrasound in breast evaluation? A. It helps distinguish fluid-filled cysts from solid masses and is especially useful with dense breast tissue. Card 167Q. When can breast MRI be useful? A. For high-risk women, women with breast implants, women with previous breast cancer, and women with difficult-to-detect masses. Card 168Q. What confirms a suspected breast cancer diagnosis? A. Biopsy, commonly a core needle biopsy or needle localization biopsy. Card 169Q. What does ER-positive breast cancer mean? A. The cancer cells contain estrogen receptors and may respond to hormonal therapy. Card 170Q. What does HER2-positive breast cancer indicate? A. HER2 overexpression is associated with increased cell proliferation and more aggressive tumor behavior. Card 171Q. What is triple-negative breast cancer? A. Breast cancer that lacks estrogen, progesterone, and HER2 receptors. The chapter describes these tumors as more aggressive with limited treatment options, usually chemotherapy-based. Card 172Q. What is lumpectomy? A. Removal of the breast tumor plus a rim of healthy tissue to obtain clear margins. Card 173Q. When is breast-conserving surgery commonly used? A. Primarily for selected early-stage breast cancer, especially stages I and II. Card 174Q. What is a mastectomy? A. Surgical removal of the breast, including the nipple and areola in the procedure described. Card 175Q. What is a sentinel lymph node biopsy? A. Removal and examination of the first lymph node receiving lymphatic drainage from the tumor. Card 176Q. Why is sentinel lymph node biopsy useful? A. It evaluates possible lymphatic spread while reducing the risk of lymphedema, compared with complete axillary dissection. Card 177Q. What is the purpose of radiation after breast-conserving surgery? A. To destroy remaining tumor cells and reduce local recurrence. Card 178Q. What are common adverse effects of breast radiation? A. Breast swelling, heaviness, sunburn-like skin changes, fatigue, and possible lymphedema when the axilla is treated. Card 179Q. What is adjuvant chemotherapy? A. Chemotherapy given after surgical removal of the tumor to eliminate or suppress microscopic residual disease. Card 180Q. What are major adverse effects of chemotherapy? A. Leukopenia, neutropenia, thrombocytopenia, anemia, nausea, vomiting, anorexia, mucositis, and hair loss. Card 181Q. What is tamoxifen? A. An anti-estrogen medication that blocks hormone receptors on breast cancer cells. Card 182Q. What is an important serious adverse effect of tamoxifen? A. Increased risk of deep vein thrombosis, stroke, and endometrial cancer. Card 183Q. What is raloxifene? A. A selective estrogen receptor modulator used for osteoporosis prevention and reduction of invasive breast cancer risk in selected postmenopausal women. Card 184Q. What is an important contraindication for raloxifene? A. Active or previous venous thromboembolism. Card 185Q. What are aromatase inhibitors? A. Drugs such as anastrozole and letrozole that reduce estrogen production in postmenopausal women by inhibiting aromatase. Card 186Q. What major complication should nurses monitor for with aromatase inhibitors? A. Reduced bone strength and increased risk for osteoporosis and fractures. Card 187Q. What is an important nursing precaution after mastectomy or axillary surgery? A. Avoid blood pressure measurements, injections, and blood draws on the affected arm. Card 188Q. What postoperative problem should the nurse monitor after breast surgery? A. Incision changes, drainage, swelling, arm swelling, circulation problems, pain, and signs of lymphedema. Card 189Q. What is an important patient teaching point about postoperative breast surgery drains? A. Empty and measure the drains as instructed and record the amount and time of drainage. Card 190Q. Why are breast cancer survivorship visits important? A. They monitor recurrence and address long-term effects, such as vasomotor symptoms, sexual dysfunction, infertility, osteoporosis, fatigue, cognitive changes, neuropathy, and cardiac complications. High-yield NCLEX memory cards. Card 191Q. Amenorrhea plus strenuous exercise and low body weight should make the nurse think about what? A. Hypothalamic suppression and the female athlete triad. Card 192Q. A woman with amenorrhea should be tested for what before extensive diagnostic testing? A. Pregnancy. Card 193Q. Primary dysmenorrhea is driven primarily by what mediator? A. Prostaglandin F2 alpha. Card 194Q. What medication class is most important for primary dysmenorrhea? A. NSAIDs. Card 195Q. Fishy vaginal odor plus clue cells points to what? A. Bacterial vaginosis. Card 196Q. Cottage cheese-like discharge plus vaginal pH below 4.5 points to what? A. Candidiasis. Card 197Q. Frothy yellow-green discharge plus strawberry spots points to what? A. Trichomoniasis. Card 198Q. Painless chancre points to what? A. Primary syphilis. Card 199Q. Palms and soles rash points to what stage of syphilis? A. Secondary syphilis. Card 200Q. Lower abdominal tenderness, bilateral adnexal tenderness, and cervical motion tenderness should make the nurse suspect what? A. Pelvic inflammatory disease. Card 201Q. What major reproductive complication is associated with PID? A. Infertility and increased risk for ectopic pregnancy. Card 202Q. Painful recurrent genital ulcers with prodromal tingling point to what? A. Genital herpes. Card 203Q. Which STI is strongly associated with cervical cancer? A. High-risk HPV. Card 204Q. Which breast cancer finding can produce orange peel skin? A. Invasive breast cancer causing edema and shortening of Cooper ligaments. Card 205Q. What breast imaging test is considered the standard screening method? A. Mammography. Card 206Q. What test confirms a suspicious breast mass? A. Biopsy. Card 207Q. Which breast cancer receptor status predicts potential response to endocrine therapy? A. Estrogen receptor and progesterone receptor status. Card 208Q. Which breast cancer subtype lacks ER, PR, and HER2 receptors? A. Triple-negative breast cancer. Card 209Q. What should the nurse never do on the affected arm after breast surgery involving lymph nodes? A. Do not take blood pressure, draw blood, or give injections on that arm. Card 210Q. What is the central nursing approach throughout this chapter? A. Assess carefully, identify the underlying cause, educate the patient, support reproductive and sexual health decisions, prevent complications, and provide appropriate follow-up.